What's the most scary experience you've ever had in life? But listen to this. A doctor's fresh wound came into direct contact with HIV-infected blood while she was operating a patient. Dr. Khadija Mbeneka talks to Najma Ismael about her life-changing experience as a medic and takes her final HIV test on national television.
About some of the occupational hazards most professionals come across, I take you to Meru County to tell you the story of a nurse who almost contracted HIV in her line of duty. Deep inside Meru County, at a place called Charia, 20 kilometers from the town, there's a missionary hospital located at Kotolengo Center. The hospital is a beehive of activity most of the time due to the very affordable, almost free medical services that they offer.
Our idea has been from the beginning to be the hospital for the people who cannot afford other hospitals. Our location is not very much reachable, but is in the villages.
28-year-old Khadija Mbeneka is a doctor here, and coming to Kotolengo was a huge challenge. Many discouraged her from practicing at the hospital, but she decided to take the risk. One morning when her boss was away, Dr. Khadija encountered a life-threatening experience. There was a patient who needed a minor surgical procedure. On that fateful morning, Dr. Khadija cut herself while making suhoor meal for Ramadan. The wound was very deep, however she paid no attention to it and dressed it accordingly and went to work. She was extra careful during this particular minor surgical procedure. She did not prick herself, but
we tested the patient. And the patient was HIV positive, but it wasn't an issue. And during the procedure, I was very careful because I remembered that I had a wound and I was dealing with infected blood. So I wore double gloves, I wore 2 gloves, and the procedure was very smooth. But accidentally, during the procedure, I picked the glove with a forceps. It really tore and blood entered directly onto the wound.
She was devastated, but being a professional, she followed the necessary steps.
So it was a very traumatizing experience at that moment because I realized the patient was positive and this was a high risk case. I immediately changed the glove. I immediately removed the gloves. I washed the hands, my hands with an alcohol-based solution, and I scrubbed again, and I wore a fresh pair of gloves. The way we dressed in theater, and I continued with the procedure.
An open wound coming in contact with infected blood increases the risk significantly to 0.09%, that is 9 in every 100 cases. Dr. Khadija was immediately put on ARV drugs.
It was stressful, and I was scared, and I didn't know I didn't know what to expect. I didn't know if I could endure the side effects of the drugs. I didn't know if I had wasted too much time.
The role switched with a blink of an eye, and the doctor was now the patient.
I was very cautious. I didn't want people to see the contents of my handbag or the contents of my drawers because people can judge. And the HIV drugs, the antiretroviral drugs, they are packed in a characteristic white bottle that everybody knows about it. Many people know about it.
The ARV journey came to an end after 30 days. She got tested at 6 weeks post-exposure, 8 weeks, and also did her testing after 12 weeks. She was okay. However, she still had one more test to do after 6 months, which would determine her final condition.
There is only one line on the control side. So the investigation is you are HIV negative. So today we declare you HIV negative at 6th month after your paper.
Thank you very much. I'm happy that I took the drugs well, and I've proven that if you take your treatment well, you will be, you will not contact disease. And I'm happy that I've finished this journey successfully.
Watch the full story of Dr. Khadija Mbeneka on All Woman. Najma Ismael, KTN News.